October is National Breast Cancer Awareness Month. Breast cancer is the most common cancer in women worldwide, accounting for 12% of all new cancer cases.
And here in the United States, more than 300,000 women are diagnosed annually. Today, we have Dr. Jason McKellop. He's a medical director of Breastlink Women's Imaging Center in Tarzana. And we're going to talk about the options that women have. Great to see you. Welcome back.
Thank you so much for having me back.
So this is an important topic. We're going to talk about the numbers and if we're seeing an increase, and you have some interesting things to talk about when it comes to survival rate as well.
Absolutely. So what we've noticed over the past 50 years is that there's been a steady increase in the rates of breast cancer. So the incidence of breast cancer has been increasing over time. But encouragingly, the survival rates of breast cancer are decreasing. And that's largely attributed to successful screening programs. Patients who adhere to a screening paradigm, breast cancer screening through mammography, have survived breast cancer at greater than 40% clip improvement compared to years past.
All right, there's a new report out that says there's a rare form of breast cancer on the rise here in the United States. It's called lobular breast cancer. What is that?
Yeah, so invasive lobular carcinomas account for 10% of all cancers diagnosed. So it's a less common form compared to its counterpart, invasive ductal carcinomas. And the important thing to note about invasive lobular carcinomas is that they're very difficult to see on our imaging studies. They can be a very challenging finding to make on a mammogram. And the reason that's the case is because the growth pattern of invasive lobular carcinomas are different than invasive ductal carcinomas, which typically create masses which are more apparent on our imaging studies. Invasive lobular carcinomas tend to grow along the architecture of the breast and make it more challenging to see on X-ray.
Well, then that gets us to our next question, which is how important are mammograms? I mean, every female probably needs to get a mammogram, and then at what age? Yeah,
so mammograms are our gold standard. It's our bread and butter screening utility when it comes to screening for breast cancer. We recommend that all women begin breast cancer screening at age 40 and do so on an annual basis thereafter. If you're at high risk of developing breast cancer, if you have a genetic predisposition or if you have a strong family history, you may start as early as age 30.
What is the difference between a regular mammogram and an EBCD, and do we know if it actually works?
All right, so EBCD is our newest and most exciting weapon in our fight against breast cancer. It basically incorporates artificial intelligence into our existing breast cancer screening algorithm. And it's not merely an artificial intelligence algorithm, it's a paradigm shift, really. And by incorporating artificial intelligence, it enhances our human ability to detect a disease on imaging studies. So it's a very important and very novel advancement, and we do know that it works because we've had the experience of looking at data across millions of people. I'm fortunate enough to work for a company, RadNet and Breastlink, that has a large footprint across the US, and we see millions of patients through mammography. We're responsible for greater than 5% of all mammograms performed in the country. And over 2 million people have already opted into this EBCD program, and we're noticing a greater than 20% increase in cancer detection when opting into this program.
You must be excited about that.
Oh, incredibly
as a
excited.
doctor,
Yeah.
right?
Yeah, this translates to more lives saved, and that's the reason that I do what I do for a living.
So it's technically AI, and then we usually have the radiologist who views the X-rays or the mammogram. What if they disagree?
So in the situation where we have a discrepancy, let's say the radiologist says that the exam is normal or benign and passes the exam, and the artificial intelligence detects something, then we bring in yet a third layer of scrutiny, a second pair of human eyes to reconcile that difference. So there are multiple layers of scrutiny on the same exam, and that offers greater accuracy and greater sensitivity for detecting cancers.
Fascinating.
No second opinion from AI, though. All right, a lot of people don't realize this, but men can also develop breast cancer, although it is pretty rare.
Yes, it's a rare form of breast cancer. It accounts for less than 1% of all breast cancers diagnosed. About 1 in 800 men may develop breast cancer in their lifetimes. Compared to women, about 1 in 12 women will develop breast cancer in their lifetime, so less common. And for that reason, there isn't a screening protocol for men. For men, we recommend that they be aware of their anatomy, they visit with their healthcare provider, and get frequent physical exams.
All right, Dr. McKellop, thank you so much. Really interesting information.
Thank you so much for having me.
Thanks.
Appreciate you.
All right.